Welcome back to Inside South Florida. September is National Prostate Month, and here to tell you what you need to know is Dr. William Figlesthaler, a board-certified urologist. Dr. Figlesthaler, it is great to have you on the show. It's a very important topic to talk about. Thank you so much for spending some time with us this morning.
Thank you. Thank you for the opportunity. It's a pleasure to be here.
All right, so I guess September is National Prostate Health Month, right?
Yes, it is.
So this is obviously, it's important to talk about it all year long, but this is, I guess, the month to really focus in on it. So a kind of a basic medical question, if you can boil it down, prostate cancer is what?
Well, the prostate cancer is when the cells of the prostate gland, which is a reproductive gland in the male pelvis, when those cells begin to grow out of control with the rest of the cells in the prostate. And when they grow out of control, they can actually cause problems with bleeding, they can spread to other parts of the body, and there you have prostate cancer.
And this is, in terms of male cancers, this is a fairly common one, right?
Very common. It is actually the most common cancer in males, and the second leading cause of cancer death in
Wow.
the second leading cause of death in males.
Wow. Why is it so common?
Well, I don't know why it's so common,
Right.
but as far as some quick numbers, about 200,000 cases a year and about 30,000 deaths per year with prostate cancer.
Unbelievable. All right, so let's go through all the risk factor symptoms, getting checked, and all that stuff. Let's start with risk factors. Are there any?
Most prostate cancers are what we call sporadic, where we don't know, why it came up. You'll have families that are perfectly healthy with no cancer, and then they get prostate cancer. That would be the majority. There is a familial-based prostate cancer where, for example, if you have one first-degree relative, your chances go from 1 in 9, which is the baseline for all of us, go up to 1 in 7, and if 2 of those individuals in your family have cancer, it goes to 1 in 4. There's been some suggestion that a high-fat diet may be somewhat linked to prostate cancer, and on the flip side of that, a healthy heart diet is actually protective against developing prostate cancer.
You led me right into my next question. So, okay, healthy heart diet. Is there anything else that we can do to prevent us from getting prostate cancer? Anything at all? Exercise, anything like that, or no?
Well, it's difficult to do a controlled study, on people to determine for sure what will cause it or what won't cause it. But what we found, which is anecdotal evidence, is that when, for example, the Japanese diet is very low in fat, and the Japanese people have very little prostate cancer in Japan. But when the Japanese move to the United States and they have a family of generation here, they have the same risk and the same development of prostate cancer. So we know there's a diet-based risk factor, and we think it might have to do with the American diet, which has a lot of fat.
So, you always hear good fats and bad fats. So I know we're a little off topic, but in terms of your diet, are there okay fats to eat to not worry about it?
I think that in the terms of prostate cancer, it's just in general. It's very generalized. To the American diet. Having more fat than some of the other diets, there's a slightly higher risk for prostate cancer in that diet. But as far as breaking it down into different fats, I can't tell you that. Yeah.
Right. Okay. So symptoms. What are some symptoms?
Well, the unfortunate thing or fortunate thing is that there really are no symptoms early in the disease. We now have biochemical markers like PSA, and there are some other ones that can tip off your physician that there may be a problem. Also, there could be changes on your digital rectal exam, which is another important annual examination that you need. But when cancer is early, there will be no symptoms. When it gets more progressed, you could have symptoms of difficulty urinating, frequent urination, getting up several times at night to urinate, incomplete bladder emptying, maybe even blood in the urine.
Okay. What age should men start getting checked?
Well, if you have a negative family history, and if you're non-African American, then you can start at age 50. And you get your annual digital rectal examination and a PSA blood test. If you have a positive family history and you're African American, you want to start at age 40.
Okay.
Either of those two things.
Okay. So if you find prostate cancer, what are some of the treatment options before ultimately surgery?
Well, all of that, of course, is going to be on an individualized basis. And so when we do shows like this, we have to be careful that when we sing praises to a certain treatment, we're not recommending that treatment for everybody. But when cancer is caught very early, There are two really good treatments that are available. One is radiation therapy, and there's different forms of radiation therapy, different ways of delivering radiation to the prostate. There's seed implantations, there's external radiation, and there's some nuances to those two things, and then there's surgery. And nowadays, the way to go with surgery is robotic prostatectomy. We use minimally invasive surgery, it's laparoscopic surgery, and we use a robot with tiny little incisions to actually remove the prostate and spare the nerves, spare the bladder sphincters, and just remove only the cancer.
Post-surgery, this is kind of a sensitive question, but it's an important one, I think, for a lot of men. What is the prognosis? I guess it depends on the type of surgery, but for having a fully effective, being able to use all of your plumbing and stuff, if you understand what I'm saying.
Of course.
Right.
When somebody has what's basically called organ confined disease, where the cancer is localized to the prostate, which is the majority of cases today, and they undergo robotic prostatectomy, the odds are very high, better than 95%, that they're going to have normal bladder function, as long as they didn't have abnormal bladder function before. In other words, they're going to be able to urinate, they're going to be able to hold their urine. They may go through a period of time where they're having leakage or incontinence while the muscles and the sphincters are healing, but 95+%, nothing's 100% in medicine, but 95+% are going to retain bladder control. As far as erectile function, that's going to vary according to the patient going into the operation. If somebody, it's going to be dependent upon age and the health of the patient. So if you have a 50-year-old who's a marathon runner, eats a high fiber diet, has low, excellent health, he's going to have a very close to the high 90% of having normal erections. You have a 75-year-old with 3 heart attacks and diabetes, and he's 50 pounds overweight, and he already has some erection issues going into the surgery, he's probably going to have a problem with erections post-operatively. Now, understand that these can all be treated. There's many treatments for erectile dysfunction, and in fact, some people that have erectile dysfunction for many years never address that problem until their prostate cancer gets treated, and then they actually start becoming sexually active after they've had prostate cancer.
Yeah.
Yes. So if you go through your annual screenings and you're detected and you get treated, the whole idea is to be able to cure you and retain your quality of life.
Terrific. You're giving a lecture, right, on the 25th at 11:30. Where is it, and what will it be about?
At 11:30 on the 25th of this month, I'm giving a lecture at Coral Gables Hospital in the auditorium, and it's going to be on prostate cancer and treatments, and we're going to talk about robotic surgery. We're going to show some photos and so on. It's going to be at 11:30, and to register for that, you can call the hospital main number. It's 305-445-8461. That's 305-445-8461, and then there's also the website. It's www.coralgableshospital.com.
Dr. Figlesthaler, this was terrific. Thank you, informative, and we really appreciate it. Thanks so much.
Thank you very much.
All right, take care.